Back with covering coronavirus on this Monday, March 30th. Today we have the trend of drive-by birthday parties and a look at the different kinds of disaster responses and why it's important for you to be able to tell them apart.
With the health pandemic, the key is to be out in front of it. And that response is going to be big and it's going to be fast.
President Donald Trump announced Sunday that he's extending his administration's guidelines on social distancing during the COVID-19 outbreak until April 30th. And this is going to be in contrast to his earlier statement where he said the whole country was going to be back to normal by Easter. Governor Charlie Baker said today that a surge in coronavirus is expected to hit Massachusetts in the next 2 to 3 weeks, sometime between April 7th and April 17th. The state is preparing by urging people to stay home, stocking up on supplies, and expanding the state's bed capacity for patients. New Hampshire made another move to prevent the spread of infection in the state. Cash Easy Pass lanes will no longer make change for customers. Instead, they're going to have to use the exact amount or an Easy Pass. Kids love their birthday parties, but hard to have a birthday party when you can't have groups of people together. That's why a great trend we've been seeing is drive-by birthday parades, where friends and family make the kids feel special from a safe distance. Here's a parade for two sisters in Rockland, Massachusetts, and another one hosted by a local hockey team for a boy in Vernon, Connecticut. And the kids aren't the only ones getting drive-by celebrations. Just look at this happy birthday guy in Quincy, Massachusetts. A Connecticut pastry shop made donuts with the face of Dr. Anthony Fauci, who's been the face of the U.S. medical response to the coronavirus. And for every donut you buy, somebody in the medical community is going to get a donut too. This pandemic is hitting communities in so many different ways, including the transgender community. Our digital videographer, Shira Stoll, spoke to a person in transition who's had to have their surgery postponed due to the coronavirus.
My heart sank when I saw the email from the surgeon's office yesterday saying that I might have to but I might not be able to get the surgery. It's pretty depressing. It's been kind of like a roller coaster. It was, I was really excited about it for a while, and now I'm not sure what's going to happen. It's definitely not happening in May. Trans healthcare is suicide prevention. Gender affirming surgeries exist because for many trans people, the alternative of continuing on in a body that doesn't match how you feel inside is unthinkable. And living with gender dysphoria means that your identity is constantly at odds with your body and how people perceive you. And that conflict can be extremely emotionally and psychically taxing. So transition, including hormones and surgery, is a means of mitigating that conflict.
It's pretty easy to get nervous when you see the National Guard and Navy ships out and about right now. We have meteorologist and emergency management expert Chris Gloninger back on the show today to talk about these different kinds of responses to disasters.
There's the state of emergency, which basically allows the governor to help out local municipalities like a village, a town, maybe an unincorporated village or community to get help because their resources could be spread very thin during these times. The governor makes that call. He'll issue the state of emergency. And again, that frees up a lot of resources for local communities. The next thing, kind of when you up it a little bit, is called a federal disaster declaration. And that is when the governor goes to the federal government to ask for help because it's expected that we're in over our heads or we will become in over our heads because of what we've seen so far.
Anything else that people should keep in mind about the difference?
You may start to see FEMA show up. In some cases, again, that's when they're activated to maybe help build up hospitals. Again, that's the Army Corps of Engineers as well. You might see them present as opposed to just our local, National Guard. On the state level, you'll see a much more escalated response from the federal level. And we're already seeing that, where we saw the Comfort and the Mercy deployed on the East Coast and the West Coast. And that's kind of that federal response where, that's the Navy coming in to help as opposed to, local guardsmen on a smaller scale.
And so, I know a lot of people are nervous when they hear, the National Guard is coming or the Navy is coming. They get nervous, like, oh my God. But it's just because we need those resources at a federal level.
We do, and there's been a call for doctors in big cities like New York that are kind of overwhelmed, and you've seen doctors coming in from around the country and some that have come, nurses and doctors that have come out of retirement for this. numbers in the thousands. And that's, again, very typical when you have large, major events like this. But what's interesting is there are some differences between a natural disaster, like a hurricane, and responding to a health pandemic. With a health pandemic, the key is to be out in front of it. And that response is going to be big and it's going to be fast. With a hurricane, Rob, you usually have days that you're tracking this system and making adjustments to evacuation orders and where you're going to put your resources. You don't have that luxury. And it's still way too early to tell if we, in fact, as a nation, acted fast enough. Again, not getting into the politics of it, but then we'll start to see in the next couple of weeks, looking at the mortality rate, looking at the number of cases, if we acted fast enough in this case, and big enough in this case as well.